Okay, so we're going to take your seated position to lying down position next. We're going to have a look at the principles a little bit more in detail, and also to have a look at setting up neutral lying down on the mat using your posture check. There are two ways of getting down and getting up from the mats. One way is to start off in your seated position that you've come from your breathing, bringing the legs to bent leg sitting position. You're going to articulate or roll your spine down one vertebrae at a time to the mat. Sometimes using your hands behind the back of your thighs will help assist this in the early stages of learning the movements. You come up the same way by articulating your spine one vertebrae at a time back up to your seated position. I generally would only recommend using this once we have gone past the half roll back movement in the sequence. So I would recommend to use the alternative lying down position, which is to drop the legs to one side and roll your body down on its side slowly until you get down to lying down position. The same way, drop the legs to the sides, roll the spine over to the side, and taking yourself up to sitting position. This way is the easiest way and the most effective way to avoid causing any further back problems. So once again, taking it down to lying down position onto the mat, making sure that you have enough distance between the edge of the mat above and below on the mat. The neutral lying down position, we're starting off with your feet. I always start off from the feet and work my way up to the top of the head. Starting off with your feet hip distance apart, we're going to press down into all the full foot. You want to press down into your big toe, press down into your little toe, and also pressing down into the heel. Sometimes people walk on the edges of your feet, and this helps to avoid doing this or to start to train your mind into keeping full weight across your feet. Your knees are coming in towards each other, but they're not touching together in the middle. So we're going to have a look at your neutral pelvis. The neutral pelvis is the natural curvature in the lower part of the spine, or your lumbar spine, or it's as close as we can get the neutral spine if you've any exaggerated curvatures in the spine. We're going to use your hands in a diamond position, index fingers touching and your thumbs touching to create this diamond shape. Placing the index fingers around the pubic bone area, we're going to place the back area of the wrist on the bony part of the hip bone. This is when we start off pelvic tilts. The imprint or the tilting of the spine is when we tilt the spine down towards the direction of the mat. When you tilt your spine down towards the direction of the mat, you will see or feel the index fingers or the pubic bone pointing directly towards the direction of the ceiling. When you release back to what we call the neutral position, you will see the index fingers starting to lower towards the direction of the ground, and also you'll feel a small arch starting to create underneath the back. How we find neutral position is we do a few of each. You imprint your spine as the spine comes down towards the direction of the mat, and then you return the spine back to its arched position. Do this a few times until you get used to the movement. And then what we need to do is to try and find halfway in between those 2 points. So the spine has a tiny arch in the lower part of the back. What you will find is that the index fingers around the pubic bone area and the top area of the wrist around the hip bones line up to create a straight line. I'm going to demonstrate if you have any exaggerated curvatures in the spine. Sometimes people with lordosis will have an exaggerated curve in the spine, and you will see that there's quite a big gap underneath the lower part of the back. You will also see the angle of the hands. You will see the pubic bones are pointing down towards the direction of the mat. In the opposite case, where the back is a little bit more flattened, you will see that the spine is pressing down towards the mat. The bum might be lifting slightly because it's quite tight, and also the pubic bone is pointing upwards, the fingers are pointing upwards. So in the case where you have an exaggerated curve in the spine, we're basically just trying to find a comfortable resting position, aiming to get the pubic bone and the hip bones to line up into that neutral position. Once we have neutral position, I'm going to explain why we use neutral and why we use imprint. While I'm explaining all these positions, I just want you to continue to do your natural breathing, and we'll focus on the breathing as we go up into the posture check. So the neutral position is used during the movements, in most cases where we have the feet down on the mat. The feet, I want you to imagine, or the legs, are like pillars. They're two big, strong pillars that are able to support your back. So because we have our pillars down on the mat, we're able to keep that gentle curve or neutral position in the spine. If we have one leg raised off the mat, you still have a good, sturdy, strong pillar with your foot on the mat, so we're able again to maintain neutral position, and this can be the same on both legs. But if we have the two legs in the air, we have no pillars on the mat, so we need to do something that will help to support the back a little bit more, and this is where we change the spine into your imprint position. So once we start off in neutral, you'll see the difference in the spine. We're going to change the spine gently down into the imprint position. The imprint is not forcing your back down. It's a lengthening sensation of the spine, lengthening down gently into the mat. Once you have that lengthening feeling in the spine, we're going to take the legs up. Always take the leg up one leg and down one leg at a time. So we take one leg up and followed by the second leg up, and we're going to have a look at your imprint in this position. When the legs are in tabletop, this is with the two legs in the air, your feet need to be in line with your knees and your knees stacked directly above your hips. Now what you may find in this position is that the back will not sit comfortably into the imprint position. Do not force your back down into the mat. It might not be ready for the imprint position. So something that we can use is the cushion. So I'm just going to show you how to use the cushion while we're in tabletop position. Keeping the feet down on the mat again, raise the hips upwards and slide the cushion underneath your lower back. Gently tilt the spine into imprint. Take one leg up, followed by the second leg up. And using the cushion here should help ease off any lower back tension and take a little bit of the pressure off the front of your thighs. Now it is normal to feel tension on the front of your thighs because this is where the movement is working. So again, feet in line with your knees, knees in line with your hips. Another way of easing off some of the tension in the lower back is to bring the knees closer towards your chest and bring your feet slightly higher. This will help to maintain the imprint a little bit more comfortable for you. But please remember, if you're feeling any pain that does not feel like normal pain, as in your body is working, then I would recommend to continue using your feet on the mat. Once we're finished looking at the tabletop position, we're going to take the feet down slowly, one at a time, back in line with your hips, and release your pelvis to neutral. Remembering you release the pelvis to neutral when we have the two sturdy pillars back down on the mat to support your back. If you are using a cushion, we'll take the cushion away from the back and release the spine back down onto the mat to your neutral position. So that's your neutral pelvis position. We're moving upwards. We're going to connect with the core. So we had a look at the core earlier on, gently zipping up on the pelvic floor muscles and very gently drawing the abdominals or the transverse abdominis towards the direction of your spine. Very gentle connection. Remember, over contraction will put pressure on your back. Continuing to hold the contraction throughout the class or throughout the course of movements. You're breathing in through the nose and exhaling through the mouth, aiming to inhale for 5 seconds and exhaling for 5 seconds. Continuing to breathe, remembering to purse the lips on the exhale breath. One way of practicing the breathing in lying down is to place one hand across the lower abdominal area and one hand across the side of your ribcage around the armpit area. As you inhale, you're aiming to breathe into the side of the ribcage or into the hand that's placed around the side of the ribcage. Remember, this is done on both sides, not just on the side where your hand is. As you exhale, you feel that hand compressing or drawing inwards on the ribcage. When you're breathing correctly, using the proper connection with the core, the hand on the belly you should feel staying in the same position all the time. It shouldn't rise and fall. When you're happy with the breathing, relax the two hands down by your sides. Shoulders should be relaxed and resting away from the ears. So looking at ribcage placement, lying down in your neutral position, continuing with the breathing that we've been practicing, we're going to place one hand along the opposite side of your ribcage, just down the lower part of your ribcage, and relaxing the other hand down by your side. Bringing the straight arm all the way up over your head and bringing the arm back down again. Continuing this a couple of times, I want you to feel what happens to the ribcage underneath your other hand that's resting on the rib. What you should feel, in most cases, when you raise your arm overhead, once the arm goes right back to the floor behind you, you'll feel your ribcage lifting underneath your hand. When we're doing the Pilates movement, we're trying to keep what's called a neutral ribcage placement. As you bring your arm back behind you, find a position that stops just around about the side of your ear or within your eye line, or to a point where you're able to bring the arm back behind you but without the ribs lifting up towards the ceiling. Continue this a few times until you get the idea of the neutral ribcage placement. The idea behind the neutral ribcage placement is that a lot of the abdominal area is connected to the ribcage. So if we bring the arms too far back behind you, it creates more of a stretch and we lose the connection then with the core. As you're doing movements or any overhead arm movements during the exercises, this is where the ribcage placement comes into play, and you would stop your arms to the same position that we're practicing now. This is individual for each person. If you find that the shoulders are a little bit tight, sometimes by rotating the palms of the hands helps to release the shoulder tension. So the palms of the hands should be pointing up towards the ceiling, not carrying any tension in the shoulders of the chest. Depending on the posture around the neck area or the cervical spine, you may need to use a small cushion or a small rolled up towel to raise the head up. And this again will help to keep the neck in neutral position and will also ease off neck tension or tension around the shoulder area. Your eye line, your head should be pointing directly up towards the ceiling. You shouldn't be looking down towards your thighs. You shouldn't be looking back to the wall behind you. You should be looking directly to the ceiling. So just a recap on that neutral position or your lying down posture check. Your feet and your knees are in line with your hips in a bent leg position, pressing gently down into the full points on your feet, big toe, little toe, and heel, inside and outside edges of your feet. Your knees are coming in, but they're not touching together. Your pelvis is in neutral. Your pubic bone and your hip bones are in line. You have the connection with the core, pelvic floor and abdominal muscles contracting. You're doing your breathing lateral thoracic, in through the nose for 5 and out through pursed lips through the mouth for 5. Expanding and contracting the rib cage. Shoulders are relaxed away from the ears. May need to use the palms of the hands to face up towards the ceiling to reduce neck tension and shoulder tension. The head is resting on the mat or on a small cushion or rolled up towel, eye line directly looking up towards the ceiling. So this is your neutral posture check. And you will use this before and after each movement change to make sure the body is in the right position. So now we're ready to move on to your first movement.